So, Dr. Shah, you've also trained in refractive surgery, right? So that's the art of spectacle removal,
Yes.
and that's a very uh, technology infested science, right? So
Yes.
there's lots of technology that is changing. It's coming in every day.
Yes.
There's a revolution that's happened, and there were patients who in the yesteryear were coming only for cosmetic purposes, but now that has expanded to different horizons, and patients are getting it done for different, I would say, different forays of their life, and for some government job or probably a requirement in their profession or their hobbies. So, what do you think refractive surgery today as a science is, and are we India as a country? Are we ahead or are we lagging behind in the science?
I feel India is ahead or at par because there are so many, um, developments happening in India. So many
Right.
machines that are, being launched are tested in India.
Yeah.
You were on the,
On the
what do you
silk.
say, the board
Yeah.
when Silk was being
Yeah.
tested in India.
Yeah.
I was a part of ADOS.
Yes. Yes.
When it was in the pre-design stage back when I was in fellowship. So all these things, machines are being made, new technology is being developed, it's
Yeah.
constantly there. I feel India is doing a great job.
Yeah, but there's this big jargon of different words. How do you the patient is confused, who are doctors? Why? Because let's say I'm a single practicing surgeon who has a small practice who has X machine,
Yes.
right? And another single practicing surgeon gets Y, and he says Y is better. Of course, the patient will hear what is being broadcasted on social media, right?
Yes.
So, how do you convince yourself that the machine that you're using is good, and how do you convince the patient, right, that this machine is good and that machine is not bad either?
Yes.
Because there's a lot of hoo-ha on internet saying that
Correct.
X is better than Y.
Correct.
So yeah,
When it comes to convincing myself, I go and check it out for myself.
yeah,
I will use the machine or read up about it, or as much as possible use it.
Yeah.
We have a network and so many platforms available. We can actually try and see what works,
yeah,
not just go by what someone else is saying, but do it for yourself. Read the literature, see what's there, see the data. Okay.
Yeah.
Only when I'm convinced can I actually convince my patient.
right,
So that's that. And as far as when patients come in, say we have an X particular technology that we're using, I very simply tell them that this is a brand.
yeah,
And if I'm convinced that A, B, and C are similar or equivalent,
yeah,
but just different brands,
yeah,
that's how I tell them that it's a different brand. But the procedure, what we're doing, the outcome that you're going to get is going to be the same.
right.
Okay, we have this, and this has, excellent results and consistently over the last so many years. So this is what we can offer you.
Okay, so these procedures, namely LASIK, Contour LASIK, uh, wave light technology, silk, smile, clear, they're all procedures that are done on the cornea, right?
Yes.
So they all have certain amount of limits to them.
Yes.
Like we need to have a certain amount of thickness of the cornea. The power
Yes.
should be such. But yeah, there are options which for corneas which are very thin or the powers which are very high.
Yes.
Can we dive into that and can we discuss those options for patients whose powers is very very high?
Yes.
So what options do they have?
So there are two options that
Yeah.
one would win. And these are lens-based procedures. So
Okay.
when the corneal thickness is not adequate, or if the shape is not, optimum for any
Right.
laser-based procedure, be it
Right.
PRK, LASIK, or a lenticule-based procedure,
Right.
then the next option that I would think about is something called an ICL, which is a phakic IOL.
Yes.
Okay, so implantable column lens or contact lens, or
Yeah.
multiple names, but it's a phakic IOL. Phakic
Right.
because the natural lens is intact. What we're doing is putting a specialized lens inside the eye in that little narrow limited space.
So the patient doesn't take out the lens, right?
The
So it's-
patient doesn't have to put
Yeah,
the lens.
like a
It's
contact
placed
lens.
inside the eye, and
Okay.
no, it is not visible from the outside. It's not going to fall out. It's a surgery and it is properly placed.
Right.
Okay, it's a made to measure lens, so it fits properly and to the measurements of the eye, to your eye power.
Yeah.
Okay, however, that also has its criteria. Okay, there are strict selection criteria. Not everyone can go ahead with it. There has to be, if we're placing a lens inside the eye, which is already a very narrow space,
Because the eye is very small.
utni jagah honi chahiye. So it can't, if the space is narrow, then we naturally can't use that technique. If that is not possible, then there is another procedure which is called a refractive lens exchange or a clear lens extraction, wherein we remove the lens. So it's similar to doing a cataract surgery, but in the absence, there's no cataract.
Okay.
And then we replace it with an artificial lens, which, one of the progressive lenses which covers vision at all distances, mimicking your natural vision as much as possible. So these are the two options that one would think of if a laser-based corneal procedure is not possible.